Recent IMF data shows that Americans now earn about one-third more than Europeans in dollar terms, with US GDP per capita at roughly $63,000 compared to the EU's $47,000. On paper, this gap suggests a clear advantage for Americans. But when you look at self-reported life satisfaction, a different pattern emerges. Europeans consistently rate their lives higher, with EU surveys averaging 7.3 out of 10 compared to 6.8 in the US. This contrast challenges the idea that higher incomes automatically translate to greater well-being. It raises important questions about what these numbers really capture and whether traditional economic measures like nominal GDP give us the full story. To understand this paradox, we need to look more closely at how prosperity is actually measured. The 2025 GDP Paradox. The 2025 GDP paradox centers on a persistent gap between headline economic figures and the realities of daily life. According to the World Bank's 2025 data, US GDP per capita has climbed to $58,000, while Europe's remains at $42,000. This apparent difference, nearly one-third higher for the US, has fueled the narrative that Americans are significantly wealthier than Europeans. Yet, when we examine what these numbers actually represent, the story becomes much less straightforward. GDP has long served as the main yardstick for comparing the economic performance of countries. It measures the total value of all goods and services produced within a nation's borders. On the surface, it seems to offer a clear, objective basis for judging prosperity. But the way GDP is calculated and compared across countries introduces several distortions, especially when evaluating regions with different currencies, social policies, and economic structures. One major issue arises from currency conversion. Analysts typically translate European GDP from euros to dollars using current exchange rates. However, exchange rates reflect financial markets, not the real cost of living or purchasing power on the ground. When the dollar strengthens, European incomes appear smaller, even if nothing has changed for European households. This can exaggerate the income gap in international comparisons. GDP also overlooks key aspects of economic life. It accounts for paid work, but ignores unpaid contributions like childcare, elder care, and volunteer work, which are more prevalent in some societies than others. Two countries with similar GDP per capita could offer very different standards of living if one provides more generous public services, or if people spend less on essentials like healthcare and housing. The 2025 data highlights further limitations. American households spend much more out-of-pocket on healthcare and education than Europeans do. These expenses inflate US GDP, but they don't necessarily reflect greater well-being. In many cases, they represent higher costs for services that Europeans receive through public programs. So, while GDP per capita is higher in the US, this does not always translate into more disposable income or better quality of life. Public services in Europe also play a major role that GDP doesn't fully capture. Universal healthcare, subsidized childcare, and extensive public transportation all enhance living standards, but their value isn't always visible in GDP figures. These services reduce the need for private spending, leaving more room in household budgets for other priorities. Work culture and leisure time further complicate the picture. Europeans, on average, work about 300 fewer hours per year than Americans, almost 2 months less time spent on the job. This choice lowers GDP per capita, but potentially increases life satisfaction. More leisure time, longer vacations, and a healthier work-life balance contribute to well-being in ways that GDP cannot measure. Housing is another area where GDP comparisons fall short. Many European cities have policies that keep rents affordable and regulate housing costs, which means Europeans often spend a smaller share of their incomes on housing than Americans do. This leaves more disposable income for other needs, but these savings are not reflected in GDP statistics. Differences in the cost of everyday goods and services also influence real living standards. While Americans may earn more in nominal terms, many daily expenses, such as groceries, dining out, and public transit, are often cheaper in Europe. This higher purchasing power narrows the effective gap in what people can actually afford. Quality of life indicators reinforce the idea that GDP alone cannot explain the differences between American and European experiences. Europeans enjoy longer life expectancies, more accessible public services, and comparable educational outcomes at lower costs. These factors contribute to well-being, but are largely invisible in traditional economic data. The paradox is clear: higher incomes do not automatically mean better lives. The 2025 data underscores the need for more nuanced tools to assess prosperity, ones that account for both economic output and the lived experiences of ordinary people. This complexity becomes even more apparent when we look beyond GDP to the question of productivity, a topic that has sparked renewed debate in recent reports. Productivity myths debunked. Many discussions about economic strength rely on productivity comparisons, often citing figures that show European workers producing less per hour than Americans. According to recent reports, European productivity per hour worked is about 22% lower than in the United States. At first glance, this suggests European workers are less efficient, but the reality is more complicated. Productivity statistics focus on output per hour, but they ignore the total number of hours worked each year. When total hours are considered, the gap between the two regions narrows. Between 2019 and 2024, labor productivity per hour worked in the United States rose by 6.7%, while the euro area saw an increase of only 0.9%. Much of this divergence emerged after 2020, as the US experienced a stronger rebound in productivity, partly due to a sharper reduction in labor input during the pandemic and a quicker recovery. The gap widened again after 2022, when the euro area faced a significant energy price shock, which depressed productivity growth across sectors. In market services, U.S. hourly productivity increased by 12.4%, compared to just 3.8% in the euro area. In industry, the U.S. saw an 8.8% increase, while the euro area managed only 0.8%. These headline numbers, however, reflect differences in work patterns as much as they do efficiency. Europeans work fewer hours per year, on average about 300 fewer than Americans, which is nearly 2 months less time spent on the job annually. When adjusting for the total hours worked, the productivity gap shrinks to around 8%. This difference is not just a matter of output, but of policy choices and cultural preferences. Many European countries have shorter work weeks, longer vacations, and more generous parental leave, all of which reduce measured productivity but contribute to higher life satisfaction. The cyclical nature of European productivity also plays a role. During downturns, European firms are more likely to keep workers employed but reduce their hours, which lowers measured productivity but preserves jobs. In contrast, American firms often lay off workers during contractions, which raises average productivity among those who remain. This reflects different approaches to labor market stability, not necessarily a difference in worker capability. Sector composition further influences the statistics. The U.S. economy has a larger share of high-growth technology and service firms, where productivity gains tend to be faster. European economies, by contrast, have a greater proportion of traditional manufacturing and public sector employment, where productivity improvements happen more slowly. When similar industries are compared directly, the differences often become less pronounced. Cultural and policy choices also shape these outcomes. Europeans tend to value work-life balance, often opting for more free time over higher wages. Benefits like universal healthcare, subsidized childcare, and extensive public services reduce the need for higher incomes to maintain a similar standard of living. Americans, on the other hand, may work longer hours to cover higher out-of-pocket costs for basic services. The way productivity is measured can also obscure important differences. European firms often invest more in worker training and benefits, which may not immediately translate into higher output, but can improve long-term workforce quality. American firms, meanwhile, may prioritize short-term productivity gains. These strategic differences affect the numbers, but don't necessarily reflect real efficiency gaps. Energy prices have added temporary distortions. Europe's reliance on imported energy, especially from Russia, made the 2022 price shock particularly severe, depressing productivity in the short term. The U.S., as an energy exporter, was less affected by these global price changes. Looking at longer-term trends, U.S. labor productivity has grown roughly twice as fast as in the euro area over the past 2 decades, pointing to deeper structural factors like differences in technology adoption, research investment, and entrepreneurial activity. However, even within Europe, there is considerable variation. Northern European countries with flexible labor markets and strong tech sectors often show productivity levels much closer to those in the US, while more rigid economies in Southern Europe account for much of the overall gap. Demographic factors also play a role, as Europe's population ages more rapidly than America's, potentially slowing productivity growth further. Older workers may see slower gains, but they contribute experience that isn't always captured by standard measures. Ultimately, these productivity statistics reflect a range of choices about how to balance work, income, and quality of life. When people can trade income for more leisure or greater social benefits, productivity numbers alone don't capture the full picture. To understand what these differences mean for everyday life, it's important to look at how far incomes actually go in each region. The purchasing power illusion. A closer look at how economists compare incomes across countries reveals a persistent pitfall: the illusion created by nominal GDP figures. These comparisons rely on exchange rates, which can misrepresent the real value of what people earn and spend in their own countries. For example, a basket of groceries priced at $100 in Chicago might cost only 65 euros in Berlin. Yet, when these values are converted at prevailing exchange rates, the comparison treats them as equivalent, ignoring the fact that local prices can differ substantially. This oversight leads to the impression that European incomes are much lower than they actually are for those living and spending in Europe. To address this problem, economists use purchasing power parity, or PPP. This adjustment method looks beyond currency values and focuses on what people can actually buy with their incomes in their home countries. By comparing the prices of a standardized set of goods and services, PPP offers a more accurate picture of real living standards. The latest PPP data shows that European purchasing power is about 90% of American levels, compared to the 72% suggested by simple exchange rate conversions. This correction, an 18 percentage point difference, significantly changes the narrative about relative prosperity. The root of the distortion lies in how exchange rates are set. Currency values shift with financial markets, investor sentiment, and interest rate changes, not with the day-to-day costs faced by ordinary families. A stronger dollar makes European GDP seem smaller in dollar terms, even when nothing changes for European households. The recent slide of the euro against the dollar has amplified this effect, making it look like European prosperity is falling behind, even though the local experience remains largely unchanged. Everyday expenses highlight the value of PPP adjustments. Housing in major European cities is often 30 to 40% cheaper than in comparable American cities when measured by price per square meter. Public transportation offers another example. A monthly pass in Berlin costs around 80 euros, while similar access in a US city can run $150 or more. These differences mean that Europeans spend a smaller percentage of their incomes on essential services than nominal GDP suggests. Food prices further demonstrate the gap. While Americans may take home higher nominal salaries, Europeans pay less for staples. A liter of milk in Germany costs about 90 cents, compared to $1.20 in the US. A dozen eggs might cost €1.80 in Europe, but $2.50 stateside. These savings accumulate across countless purchases, allowing European incomes to stretch further in daily life. Healthcare spending is another area where PPP reveals a hidden advantage for Europe. Americans spend nearly twice as much per person on healthcare, yet health outcomes are broadly similar. Europeans, in effect, receive equivalent care for half the price. This difference is invisible in nominal GDP figures, but becomes clear when using PPP, which takes into account the true cost and value of services consumed. The service sector also exposes the limitations of nominal comparisons. Everyday services, like restaurant meals or haircuts, often cost 30 to 50% less in Europe than in the US. A dinner for two at a mid-range restaurant might be $80 in Chicago, but only 50 euros in Paris. For most people, whose spending is largely local, these price differences matter far more than international currency fluctuations. Regional variation complicates the picture. Southern European countries such as Spain and Greece tend to offer even greater PPP advantages than northern nations like Germany or the Netherlands. Likewise, prices in American coastal cities are much higher than in the Midwest. While PPP averages smooth out these local differences, they still provide a much more realistic comparison than nominal GDP. For the middle class, PPP adjustments are especially important. While the wealthy can take advantage of global price differences, most people spend the bulk of their income at home. What matters is not just how much they earn, but how much their earnings can buy. Some exceptions remain. After the 2022 energy crisis, European households faced higher energy bills than Americans, though greater energy efficiency and widespread public transit softened the blow. And for certain durable goods, like electronics and cars, prices are more globally uniform, so Europeans may spend a larger share of their income on these items. Still, Europeans tend to prioritize services and experiences, where PPP works in their favor. Taxation is another factor. Europeans pay more in taxes, but receive more in public services, while Americans pay more out of pocket for similar needs. PPP captures the overall impact by measuring what people can actually purchase after all costs are considered. Ultimately, PPP adjustments reveal why Europeans often report higher life satisfaction despite lower nominal incomes. When prosperity is measured by what money can buy, rather than by abstract exchange rates, the gap between Europe and America is much smaller than it first appears. This difference becomes even more apparent when we look closely at how much people pay for critical services. Healthcare's hidden value. Healthcare spending stands out as one of the most significant differences between the United States and Europe. The American system costs around $12,000 per person each year, while European countries spend closer to $5,000 per person. Despite this gap, both regions achieve similar results in life expectancy and health outcomes. This contrast highlights how the structure and priorities of healthcare systems shape both individual finances and overall well-being. A major driver of higher American costs is administrative overhead. The complexity of private insurance in the U.S. means that a substantial portion of healthcare spending goes to paperwork and billing. Studies estimate that 15 to 25% of U.S. healthcare expenditures are devoted to administrative costs, compared to less than 5% in European single-payer systems. This difference alone accounts for billions in extra spending without delivering better care. Prescription drug pricing is another area where Americans pay far more. In Europe, governments negotiate directly with pharmaceutical companies to set prices, often resulting in much lower costs for the same medications. The U.S., by contrast, allows market-based pricing, which can push the cost of common prescriptions to double or triple European levels. For many families, these higher prices add hundreds of dollars to annual out-of-pocket expenses. Hospital care also reveals stark differences. An average hospital stay in the U.S. costs about $5,000, while the same stay in Europe is roughly $2,500. The gap is not explained by better facilities or more advanced technology, but by how services are financed and billed. European hospitals typically operate under fixed budgets, while American hospitals bill for each service provided, leading to higher overall charges. The approach to preventive care diverges as well. European systems tend to emphasize regular checkups and early interventions, which help reduce the need for costly emergency treatments. The American fee-for-service model, in contrast, often rewards quantity over quality, encouraging more procedures rather than focusing on prevention. Over time, this difference increases costs without a corresponding improvement in health outcomes. Access to specialist care further illustrates the spending gap. Americans see specialists more often than Europeans for similar conditions, driving up costs without clear evidence of better results. European systems usually require a referral from a primary care doctor before a specialist visit, acting as a cost control mechanism while still providing necessary care. Malpractice insurance adds to the American healthcare bill. U.S. doctors pay much more for liability coverage than their European counterparts, and these higher costs are passed along to patients. European countries, with different legal frameworks, keep malpractice expenses lower and further reduce the financial burden on families. Despite spending less, European systems manage chronic diseases more efficiently. Coordinated care for conditions like diabetes and heart disease helps prevent complications and hospitalizations. The American system, fragmented by multiple insurers and providers, often struggles to deliver this level of continuity, resulting in higher costs and poorer long-term outcomes. Health insurance overhead is another key difference. Private insurers in the US spend a significant share of premiums on administration and profits, while European public systems operate with much lower overhead. This means more of each dollar spent in Europe goes directly to patient care, rather than to bureaucracy. The financial impact on households is substantial. After insurance, American families still pay an average of $1,200 out of pocket each year for healthcare, compared to about $300 in Europe. These extra expenses reduce disposable income and can lead to difficult choices about seeking care or covering other basic needs. Employer-sponsored insurance in the US creates hidden costs as well. Companies spend large sums on health benefits, a cost ultimately reflected in lower wages for employees. Europeans, by contrast, receive comparable coverage through taxes, avoiding this wage suppression and the uncertainty of job-linked health insurance. Uninsured Americans face additional challenges. Hospitals often shift the cost of treating uninsured patients to those with coverage, raising premiums for everyone else. European universal systems avoid this kind of cost shifting, providing more predictable expenses for individuals and families. International rankings and patient satisfaction surveys consistently place European healthcare systems above the US in terms of overall performance, despite the lower spending. The extra money spent in the US does not translate into better outcomes or higher satisfaction, suggesting that the American approach is less efficient. These differences in healthcare costs ripple through the broader economy. High medical expenses in the US affect business competitiveness, slow wage growth, and contribute to personal bankruptcies, problems that are far less common in Europe. The result is a significant drag on American living standards, even for those with insurance. Healthcare is just one area where the structure of social systems shapes economic security. The way each region handles other essential services, such as education, also has long-term effects on financial stability and quality of life. Education's long-term payoff. Across Europe, the financial trajectory of university graduates looks markedly different from that of their American peers. Most European students finish their degrees with minimal or no debt, a result of public funding models and low or non-existent tuition fees at public universities. By contrast, American graduates typically carry substantial student loan balances, with the average debt load often 3 times higher than that of Europeans. This difference shapes not just the early years of a graduate's career, but their entire financial path. For a new graduate in Europe, the absence of large loan payments means that a greater share of their income is immediately available for savings, investments, or major purchases. The ability to start building wealth from the first paycheck leads to earlier milestones, such as buying a home or contributing to retirement funds. In the US, student loan payments often consume 12% to 15% of a young professional's income, delaying these same milestones. A graduate earning $50,000 per year might send $600 each month to loan servicers, money that could otherwise boost savings or go toward a down payment. The structure of higher education funding explains much of this gap. European governments treat university education as a public good, heavily subsidizing tuition and keeping direct costs to students low. In many countries, students pay only modest administrative fees, allowing them to graduate without the burden of large debts. In the US, the cost of attending public universities averages $10,000 per year for in-state students and much more at private institutions. Tuition has outpaced inflation for decades, and limited public funding has left families to shoulder most of the cost. Repayment systems add another layer of contrast. European countries often link student loan payments to income and offer forgiveness after a set period. For example, in the UK, repayments only start above a certain income threshold, and remaining balances are written off after 30 years. These policies prevent debt from becoming unmanageable during periods of low earnings or unemployment. In the US, income-driven repayment plans exist, but they typically involve longer repayment horizons and can result in tax liabilities if balances are forgiven. Debt levels influence choices well beyond finances. European graduates enjoy more flexibility when choosing careers, including lower-paying roles in public service or the nonprofit sector. American graduates, facing higher loan payments, may feel pressure to prioritize higher salaries, even if that means passing up opportunities in fields they find meaningful or socially valuable. Homeownership timelines offer a clear illustration of these effects. On average, European graduates purchase their first homes several years earlier than Americans. The difference is largely due to the time Americans spend saving for a down payment while also making student loan payments. Each year of delay can mean missing out on the equity growth that comes with homeownership. Retirement savings follow a similar pattern. Europeans start contributing to pensions and investment accounts earlier, while American graduates often postpone these steps until their loans are paid down. The lost years of compounding returns can translate into significantly less wealth by retirement age. The psychological impact of student debt is also significant. Studies link high debt levels to increased financial stress, delayed family formation, and lower rates of entrepreneurship. American graduates are more likely to report anxiety about their financial future, while European graduates benefit from a greater sense of security as they start their working lives. Wage growth and job loss further reveal the long-term consequences. While American starting salaries may be higher in some fields, a sizable portion of early career earnings is funneled toward debt service. In periods of unemployment, Americans must continue loan payments or risk penalties, whereas European repayment obligations typically pause or adjust automatically. These differences ripple through the broader economy. European graduates contribute more to local economies through spending and investment, while American graduates send a significant portion of their income to loan repayment. Over time, this divergence affects not only individual financial security, but also the economic vitality of entire communities. Education policy reflects deeper societal priorities. European countries generally view higher education as a societal investment, while in the US, it is often framed as an individual responsibility. These choices shape the financial realities of graduates for decades. Financial advantages for European graduates do not end with their education. Other areas of daily life, including transportation, further shape the economic landscape. The transportation advantage. Transportation costs show a clear divide between European and American households. Europeans spend about 8% of their income on transportation, while Americans allocate roughly 16%. This difference is not just a matter of personal preference, but is rooted in the way cities and infrastructure have developed on each continent. The result is a significant financial advantage for Europeans, who can redirect these savings toward other priorities. European cities, shaped before the dominance of the automobile, tend to be compact and walkable. Their dense layouts support robust public transit networks, making it practical for most residents to rely on trains, trams, buses, or even bicycles for daily travel. In contrast, the growth of American cities coincided with the rise of the car. Suburban expansion and zoning laws created environments where driving is often the only realistic option for commuting, shopping, or social activities. The impact of these structural differences is most visible in car ownership rates. The average European household owns less than one car, while American households typically own nearly two. This disparity translates into thousands of dollars saved each year. Europeans avoid not only the initial purchase price of a vehicle, but also ongoing expenses like insurance, maintenance, repairs, and depreciation. Public transit passes in major European cities cost between €60 and €80 per month for unlimited travel. In the US, a single car payment averages over $500 per month, not including fuel or insurance. Driving habits further widen the gap. Although fuel prices in Europe are higher per liter, Europeans drive about half as many kilometers each year as Americans. The average American driver covers around 22,000 kilometers annually, compared to about 12,000 for Europeans. Shorter commutes and accessible transit options reduce the need for frequent car use, keeping total fuel expenditures lower in Europe despite the higher price at the pump. Access to public transit is a major factor. Nearly 80% of Europeans live within a kilometer of frequent transit service, while only about 30% of Americans enjoy similar access. This makes it feasible for most Europeans to rely on buses, subways, or trains instead of cars. In many American cities, public transit is either unavailable or too infrequent to serve as a practical alternative, especially in low-density suburbs. Parking costs also play a role. In European cities, parking in central areas is expensive and limited, which discourages driving and helps fund public transit. American cities, on the other hand, often require businesses to provide ample free parking, a hidden subsidy that encourages car use and raises the cost of goods and services for everyone. Urban density amplifies these effects. European cities house roughly twice as many people per square kilometer as American cities. This makes walking and cycling realistic for many short trips. Around 40% of European urban journeys are made on foot or by bicycle, compared to just 10% in the US. These modes of travel are essentially free and offer health benefits that can reduce healthcare costs over time. Policy choices reinforce these patterns. European governments invest heavily in rail, bus, and cycling infrastructure. Higher fuel taxes fund these projects and discourage unnecessary driving. In the US, transportation budgets focus on road construction and maintenance, locking in car dependency and the costs that come with it. Time spent commuting is another dimension. Americans spend about 18% more time commuting each year than Europeans, largely due to longer distances and traffic congestion in car-dependent cities. European transit systems often provide efficient, direct routes within urban centers, making daily travel both faster and less stressful. Safety outcomes also differ. European traffic fatality rates per kilometer driven are about half those in the US. This lowers insurance premiums and reduces the societal costs associated with accidents. Infrastructure in Europe is designed with pedestrian and cyclist safety in mind, making active transportation safer and more attractive. Environmental regulations create further cost differences. European standards on emissions and fuel efficiency encourage the use of smaller, more economical vehicles. In the US, larger vehicles like trucks and SUVs are more common, increasing both purchase and operating costs. Over the past several decades, these differences have only grown. As American cities have continued to sprawl outward, commute distances have increased, and the transportation cost gap has widened. European cities, meanwhile, have maintained dense development patterns that support efficient transit and lower overall transportation spending. The economic effects of these choices extend beyond individual budgets. Lower transportation costs in Europe make urban living more affordable and reduce the need for long commutes. Employers benefit from lower wage pressure, as workers do not require as much compensation to cover commuting expenses. These savings, combined with other structural advantages, help explain why Europeans often report higher life satisfaction even with lower nominal incomes. Transportation is just one factor in the broader picture of economic well-being. Other essential expenses, such as housing, further shape the differences in disposable income and quality of life between these regions. Housing cost disparities. Housing costs stand out as a major factor shaping the economic realities of daily life on both sides of the Atlantic. The average European household spends about 25% of its income on housing, while the figure in the United States is closer to 33%. This 8-point difference directly affects how much income remains for other needs and opportunities, and it reflects both policy choices and the underlying structure of each housing market. Several features contribute to Europe's lower housing burden. Many cities implement rent controls that limit sudden price hikes, giving tenants greater financial stability. Building codes often encourage compact, energy-efficient dwellings. The average European home measures around 75 square meters, compared to the American average of about 160 square meters. Smaller homes mean lower costs for heating, cooling, and maintenance, which further reduces monthly expenses. In the United States, housing markets are shaped by different pressures. Construction costs tend to be higher, driven by both labor and materials. Zoning laws in many urban and suburban areas restrict high-density development, keeping supply tight and prices high. As a result, the typical American mortgage payment now exceeds $1,500 per month, whereas a comparable payment for European homeowners is closer to €900. These differences persist even after accounting for income levels, so the share of income devoted to shelter remains higher in the US. Rental markets tell a similar story. In Berlin, a one-bedroom apartment averages about €800 per month, while in Chicago, a comparable unit costs around $1,800. Even with higher average incomes in the US, this persistent gap leaves European renters with more disposable income for other essentials or discretionary spending. Urban planning plays a significant role. European cities, developed before the widespread use of automobiles, feature walkable neighborhoods and a mix of residential and commercial spaces. This pattern supports smaller homes and reduces infrastructure costs. American cities, which grew rapidly during the car era, often separate residential and commercial zones, requiring more extensive and expensive infrastructure. These design choices increase both housing and transportation costs. Property taxes add another layer of cost for American homeowners. Annual property taxes in the U.S. generally range from 1% to 3% of the home's value, adding thousands of dollars to yearly expenses. In Europe, property tax rates are commonly below 1%, and in some countries, assessments are based on outdated valuations, which further limits the tax burden. Maintenance and utility costs also differ. Larger American homes require more upkeep and use more energy. European energy efficiency standards, along with smaller living spaces, keep utility bills lower. These secondary costs widen the disposable income gap between the two regions. Over time, the housing cost gap has grown. In the 1980s, Americans already spent more of their income on housing, but the difference has widened as U.S. home prices have outpaced income growth. European housing markets, buffered by stronger tenant protections and public intervention, have seen more moderate price increases. First-time homebuyers experience these differences directly. European banks often require larger down payments, but offer lower interest rates, making long-term costs more manageable. In the U.S., mortgages are more accessible, but usually come with higher overall costs, especially when factoring in insurance and property taxes. The rental sector in Europe is generally more stable. Long-term leases and limits on rent increases are common, allowing families to plan their budgets with greater certainty. In the U.S., annual rent hikes are frequent, and tenants face more volatility, complicating financial planning. Homelessness rates highlight the effectiveness of different approaches. Europe's broader social housing programs and stronger tenant protections keep homelessness rates lower, even in densely populated cities. The U.S., with a more market-driven system, sees higher rates of housing insecurity, especially in urban centers with rapidly rising rents. The consequences of these housing cost disparities extend into other areas of life. Higher American housing expenses often force families to make difficult trade-offs, such as cutting back on healthcare, education savings, or retirement contributions. Europeans, benefiting from lower relative housing costs, are more likely to afford other essentials without sacrificing their quality of life. Housing quality also varies. While American homes are typically larger, European dwellings often feature higher standards for insulation, soundproofing, and durability. Building codes in many European countries require materials and construction practices that prioritize long-term comfort and efficiency, so smaller homes do not necessarily mean lower living standards. Real estate investment trends add another dimension. In the U.S., institutional investors have become more active in the single-family home market, which can drive up prices and reduce affordability for residents. European markets generally have stricter regulations limiting speculative investment, helping to preserve affordability for local buyers. Generational wealth is affected by these patterns. European homeowners often build equity in more stable markets, providing assets that can be passed down. In the U.S., more volatile market cycles expose homeowners to the risk of losing equity during downturns, making housing a less reliable store of wealth. Policy responses differ as well. European governments are more likely to intervene with rent freezes, new social housing construction, or expanded tenant protections in response to affordability crises. In the U.S., policymakers tend to rely on market forces to correct imbalances, which often leaves gaps in support. Taken together, these factors show that housing is not just a private expense, but a product of deliberate choices about urban planning, regulation, and social priorities. The gap in housing costs is a key reason why disposable incomes and reported life satisfaction differ between Europe and America, even when nominal incomes suggest a different story. The way each society structures this basic need shapes not only economic security, but also the potential for enjoying other aspects of life. The vacation dividend, a major but often underappreciated factor shaping the experience of prosperity in Europe, is the amount of paid vacation time workers receive. The difference is stark. Europeans typically have 30 paid vacation days each year, while Americans average just 10. This extra time off is not simply a perk. It produces real, measurable benefits that extend well beyond what traditional economic statistics capture. The roots of this gap lie in policy. Most European countries mandate a minimum number of paid vacation days by law, with some guaranteeing 20 days plus public holidays and others, like France and Germany, reaching 30 days as a standard. In the United States, there is no legal requirement for paid vacation, leaving it to employers' discretion. As a result, American workers generally rely on company policy, which often provides only 2 weeks of paid leave, and even this is not universal. The impact of this policy difference is substantial. Research estimates that the additional 20 days of vacation enjoyed by Europeans is equivalent to about $7,500 per year in terms of life satisfaction. This figure reflects how people value extra leisure time when making decisions about work and compensation. It also highlights the limitations of using income alone to measure well-being, as the value of time off is not captured in GDP or salary figures. The effects of more vacation time show up in multiple areas of life. Workers with adequate time off report lower stress and better mental health. Across Europe, rates of stress-related illnesses are lower, and burnout is less common than in the United States. Employers benefit as well. Job satisfaction is higher, and employees tend to stay with companies longer. European workers on average remain with the same employer almost twice as long as their American counterparts, reducing turnover costs and supporting workplace stability. Family life also looks different. European parents can more easily coordinate vacations with school holidays, creating opportunities for shared experiences and family travel. In the US, parents often struggle to align their limited days off, making family vacations less frequent and sometimes impossible. The ability to spend extended, uninterrupted time together strengthens family bonds and contributes to overall life satisfaction. The broader economy feels the effects, too. Europeans with more leisure time tend to spend more on travel, dining, and cultural events throughout the year, supporting local businesses and the tourism sector. In the US, limited vacation days lead to fewer, but often more expensive trips, concentrating spending into short periods rather than distributing it across the year. Productivity is not necessarily compromised by more time off. Studies show that European workers maintain high output per hour, even though they work fewer total days. In fact, the ability to rest and recover leads to better focus and efficiency when employees return. By contrast, American workers who take fewer breaks are more likely to experience diminishing returns from fatigue and chronic stress. Cultural attitudes reinforce these patterns. In Europe, leisure is widely regarded as an essential part of life, and taking time away from work is not stigmatized. In the US, the culture often rewards constant availability and equates long hours with dedication, making it harder for workers to fully disconnect. Even when Americans do take vacation, many remain tethered to work through email and phone calls, reducing the restorative benefits of time off. The health implications are clear. Populations with more vacation time experience lower rates of heart disease, depression, and chronic stress-related conditions. European healthcare systems, as a result, spend less on treating preventable illnesses linked to overwork. The preventive effect of regular, guaranteed breaks from work translates into real savings for both individuals and public health budgets. Differences in labor market structures help explain how these norms persist. Stronger union representation in Europe has secured better leave benefits over time, while American workers, negotiating individually, have less bargaining power to demand extended vacation. These structures entrench the vacation gap, even as work patterns evolve. The experience of time off also shapes how people approach other aspects of life. Regular breaks from work allow Europeans to participate more fully in community life, hobbies, and personal development. This contributes to higher reported life satisfaction, even when incomes are lower on paper. As societies face new pressures, from technological change to shifting demographics, the way they structure time away from work will continue to influence economic security and well-being. While vacation policies are just one piece of the puzzle, they illustrate how non-monetary benefits can have a profound effect on quality of life. Other essential services, such as those related to raising children, further highlight the financial and personal advantages that different policy choices can create. Childcare's economic impact. Childcare costs stand out as a decisive factor shaping the financial landscape for families on both sides of the Atlantic. In Europe, parents pay about a quarter of what Americans spend for comparable childcare services. This difference is not marginal. It represents a major shift in family budgets, often freeing up an extra 5 to 7% of household income for other expenses or savings. For many European families, affordable childcare makes it possible for both parents to remain in the workforce without facing unsustainable costs. This contrast stems from fundamentally different policy approaches. Across much of Europe, governments treat early childhood education and care as a public good. National and local authorities fund daycare centers and preschools, keeping parent contributions low. For example, in France, full-time daycare averages around €500 per month, while American families routinely pay $1,800 or more for similar care. Even after accounting for differences in average income, the gap in affordability remains significant. In the United States, childcare is largely a private market. Providers cover their costs through parent fees, which often rival or exceed university tuition. The average annual cost for infant care in the U.S. can reach $15,000, surpassing what many families spend on housing. With limited public support, the burden falls squarely on parents, making childcare one of the largest expenses for young families. Availability is another key difference. In Europe, most parents can access a guaranteed daycare spot for their child by age 1, with waiting lists in some cities, but broad coverage overall. In the U.S., licensed daycare slots are available for only about 20% of children under 3, creating scarcity that drives up prices further. This lack of availability forces many parents to rely on informal arrangements or reduce their working hours, with clear financial consequences. The affordability and accessibility of childcare directly influence employment patterns, particularly for mothers. In Europe, about 3/4 of mothers with young children work full-time, compared to roughly 60% in the U.S. The difference is largely explained by the feasibility of returning to work without sacrificing most of a second income to childcare costs. Where care is affordable and available, parents are more likely to maintain continuous employment and career progression. Over time, these effects compound. European parents who can stay in the workforce face fewer career interruptions and smaller long-term wage penalties. In the U.S., mothers who take extended leave or reduce hours to manage childcare responsibilities experience a wage penalty averaging 7% per child, compared to just 2% for their European counterparts. This gap persists throughout careers, affecting lifetime earnings and retirement security. Quality of care also diverges. European childcare systems generally set higher standards for staff training and compensation. Workers receive better pay and more professional development, which reduces turnover and supports consistent, high-quality early learning environments. In the U.S., many childcare workers earn near minimum wage, leading to high staff turnover and inconsistent care. Public investment explains much of this divide. European countries spend about 1.5% of GDP on early childhood education and care, compared to just 0.5% in the U.S. This funding supports not only affordability but also quality and access, creating a system that benefits families across the income spectrum. In contrast, American subsidies are targeted narrowly at the lowest income families, leaving most to bear the full cost. Tax policy adds another layer. Several European countries offer additional tax credits or deductions for childcare, further reducing net costs. In the U.S., available tax credits offset only a fraction of actual expenses for most families, leaving the overall burden largely unchanged. The cumulative effect of these choices is substantial. European families enjoy greater financial stability, higher workforce participation, and more consistent early childhood development outcomes. For American families, the high cost and limited availability of childcare often force trade-offs that affect not only household finances, but also long-term economic prospects. These disparities in childcare policy and provision are part of a broader pattern. The structure of social supports in each region shapes not only immediate financial choices, but also the sense of security that underpins everyday life. The safety net premium. One of the most significant distinctions between Europe and the United States is the value placed on the social safety net. a set of policies and protections that economists often refer to as the safety net premium. In Europe, universal healthcare and robust unemployment benefits are not just policy features, but foundational elements that shape how people navigate risk, opportunity, and daily life. European social safety nets fundamentally alter the consequences of losing a job, falling ill, or facing unexpected setbacks. Universal healthcare ensures that no one faces medical bankruptcy, while unemployment benefits often replace 60 to 80% of previous wages for up to 2 years. In Germany, for instance, workers can rely on 60% wage replacement for 24 months. By contrast, American unemployment insurance averages about 50% wage replacement for just 26 weeks, and millions of Americans remain uninsured or underinsured for healthcare. These differences influence not only financial outcomes, but also the psychological landscape in which people make decisions. The impact of this security is measurable. Economists estimate that the sense of protection provided by European safety nets adds a security premium of 10 to 12% to perceived quality of life, beyond what income alone would suggest. This premium helps explain why Europeans often report higher life satisfaction than Americans, even when controlling for income levels. The assurance that basic needs, healthcare, shelter, income during unemployment, will be met reduces daily anxiety and allows individuals to plan for the future without constant fear of financial ruin. This security influences a wide range of life choices. For example, Europeans are more likely to pursue entrepreneurial ventures, knowing that failure does not mean the loss of healthcare or basic income. Data show higher rates of self-employment in Europe across most age groups, a pattern linked to the confidence that safety nets provide. In the US, many would-be entrepreneurs delay starting businesses until they have built substantial personal savings, and some maintain side jobs purely for health insurance coverage. The effects extend to career mobility and education. Europeans are more willing to pursue mid-career retraining or take time off for longer degrees, supported by unemployment benefits during transitions. Americans, by contrast, often remain in unsatisfying jobs to avoid gaps in health coverage or income, a phenomenon sometimes described as job lock. This reduces labor market flexibility and can impact both productivity and job satisfaction over time. Family decisions are also shaped by these policies. Europeans tend to start families earlier, confident that parental leave, childcare support, and healthcare will be available. Americans frequently delay having children until they feel financially secure enough to manage costs that Europeans take for granted. This difference alters family structures and the timing of key life events. Retirement planning highlights another contrast. European workers can contribute less to private savings, knowing that public pensions and healthcare will cover essential needs. Americans must save aggressively to compensate for less generous Social Security and higher medical costs in retirement, which can limit disposable income during working years and add to ongoing financial stress. Housing stability is another area where safety nets make a visible difference. European tenant protections, housing allowances, and eviction restrictions reduce the risk of homelessness. In the US, nearly 40% of adults report being just one missed paycheck away from losing their home, a level of vulnerability that is much less common in Europe. Mental health outcomes reflect these contrasts. Europeans experience lower rates of stress-related illnesses and depression, despite similar work hours. The chronic anxiety that comes from financial insecurity in the US has measurable health consequences that don't show up in simple economic comparisons. During economic downturns, the safety net acts as an automatic stabilizer. European households can maintain consumption when unemployed, helping economies recover more quickly. In the US, job loss often leads to sharp reductions in spending, deepening recessions and slowing recovery. Labor mobility also benefits from a strong safety net. Europeans can move between regions or industries without losing access to healthcare or income support, enabling more efficient matching between workers and jobs. In the US, employer-linked benefits can tie people to specific jobs or locations, reducing flexibility. The safety net premium is not just about reducing risk. It also enables people to make fuller use of their time and resources. With fewer savings tied up in emergency funds, Europeans can spend more on experiences, leisure, and quality goods. The resulting sense of stability and freedom contributes to higher reported well-being across a wide range of surveys. While economic statistics often focus on income and output, the security provided by social safety nets quietly shapes how people use their time, pursue opportunities, and structure their daily lives. This foundation of stability sets the stage for other, less visible urban design benefits. Urban design shapes daily routines in ways that directly influence quality of life, yet the effects often go unmeasured in standard economic comparisons. In Europe, the structure of cities and neighborhoods means that most residents can reach essential amenities, such as grocery stores, pharmacies, and workplaces, within a 15-minute walk or transit ride. In contrast, American city layouts frequently require 30 minutes or more for the same errands, largely due to planning decisions made over the past century. These differences in accessibility are rooted in how cities evolved. European urban centers took shape before the rise of the automobile, resulting in compact, mixed-use neighborhoods, while American cities expanded outward with the car, separating residential, commercial, and recreational spaces. The time implications of these planning choices are substantial. Studies estimate that the average European gains back 2 to 3 hours each day through shorter commutes and more efficient access to daily needs. Over the course of a year, this adds up to nearly a month of additional waking hours compared to the average American. Time use data confirms that Europeans use this extra time for socializing, leisure, and family activities, areas in which they consistently report higher satisfaction. Transportation habits reflect and reinforce these patterns. Around 40% of urban trips in Europe are made on foot or by bicycle, while Americans drive for 85% of journeys under 5 miles. Walking to a neighborhood bakery or cycling to a local market is not only common, but often quicker than driving to distant stores in a suburban setting. The structure of European cities allows for efficient layering of errands and activities, reducing the need for separate, time-consuming trips. Public transit further enhances accessibility. Most European urban residents live within a short walk of frequent bus, tram, or metro service, and the network density allows for direct routes between destinations. In the United States, public transit coverage is limited outside major metropolitan areas, and even where it exists, it often requires longer walks, infrequent service, and multiple transfers. This makes daily travel less efficient and increases reliance on cars. Zoning laws play a central role in these differences. European cities generally permit a mix of residential, commercial, and civic uses within the same neighborhood. As a result, it is common to find shops, schools, and clinics interspersed among homes. American zoning, by contrast, tends to separate these functions, forcing residents to travel farther for basic services. This separation increases car dependency, adds to transportation costs, and eats into time that could be spent elsewhere. Urban density is another key factor. European cities average about 5,000 residents per square kilometer, compared to 1,500 in American cities. Higher density supports a greater number of businesses and services within walking distance, and it makes public transit more viable. A typical European neighborhood might offer dozens of shops, restaurants, and services within a short walk, while an American suburb might provide only a handful, often separated by large parking lots. Street network design also matters. European cities tend to have dense, interconnected street grids that offer multiple routes between points. In contrast, American suburbs often use layouts with few through streets, channeling traffic onto main roads and increasing travel times. Parking requirements further influence the urban landscape. European cities limit parking to encourage walking and transit use, while American regulations mandate large parking lots that spread destinations farther apart. These design choices affect more than just commutes. Europeans are able to combine errands with leisure, stopping at a cafe or market on their way home from work. Children often walk or bike to neighborhood schools, and older adults can maintain independence longer because essential services remain accessible without driving. In the US, longer travel distances and car dependence can isolate those who cannot drive, particularly seniors and children. Healthcare access, cultural facilities, and public spaces all reflect the same principles. General practitioners, museums, libraries, and parks are typically within easy reach in European cities, supporting higher rates of community engagement. American cities, with more dispersed amenities, require dedicated trips for these activities, making spontaneous participation less common. The cumulative result of these urban design differences is a substantial time dividend. Europeans enjoy more discretionary hours each day, which they use to enhance personal well-being, maintain social connections, and participate in community life. These benefits are not captured in GDP or income statistics, but they are reflected in higher reported life satisfaction. The structure of daily routines, shaped by city planning, also influences other aspects of well-being. One area where this is especially evident is in the way people access and experience food, a factor that further distinguishes the European approach to quality of life. The food quality factor. Food quality is a defining feature of daily life in Europe, with implications that reach far beyond taste. European food markets operate under a system shaped by strict regulations and consumer expectations that prioritize quality over quantity. While Europeans typically spend a slightly higher share of their income on groceries compared to Americans, what they receive in return is food that is less processed, more carefully sourced, and subject to higher safety standards. Regulatory differences are clear in the ingredients found on supermarket shelves. The European Union bans many food additives and processing techniques that are routine in American products. European bread, for example, is often made from just flour, water, salt, and yeast, while similar loaves in the US may contain a long list of preservatives, sweeteners, and conditioners. Shoppers in Europe encounter fewer artificial colors and flavor enhancers, and organic produce is more widely available, occupying a larger share of shelf space and coming at a smaller price premium than in the US. These quality differences come with a measurable price gap. On average, Europeans pay about 20% more for basic groceries than Americans do for the same items. However, the European versions typically feature fewer processed ingredients and higher nutritional value. This is reflected in the prevalence of organic and local products. While American organic goods often cost twice as much as their conventional counterparts, the price gap in Europe is much narrower, making quality food more accessible to a broader segment of the population. The impact of these choices is visible in health outcomes. Despite similar calorie intake, Europeans experience lower rates of obesity, diabetes, and heart disease. For instance, the French consume only slightly fewer calories than Americans, yet their obesity rate is significantly lower. Researchers attribute part of this difference to the quality and composition of the food itself, not just lifestyle or genetics. Food safety standards further widen the gap. The EU prohibits the use of growth hormones in meat production and restricts over 1,000 additives that are allowed in US foods. Animal welfare standards are also higher. European chickens, for example, are raised with more space and lower use of antibiotics. These rules raise production costs but result in products with different nutrient profiles, such as leaner meats and fewer antibiotic residues. Portion sizes and packaging also shape eating habits. European food packaging favors smaller, single-serving sizes, which helps regulate consumption without requiring conscious restraint. Yogurt containers in France, for example, are often smaller than those in the US, and cereal boxes hold less product. These defaults help set patterns that persist throughout life. School meal programs illustrate a different philosophy toward food. In many European countries, school lunches are designed as cultural experiences, often featuring multiple courses and an emphasis on fresh ingredients. American school meals, by contrast, tend to prioritize convenience and cost, frequently relying on processed foods. These early exposures influence lifelong attitudes toward food quality and eating habits. The restaurant sector follows a similar pattern. European cafes and restaurants generally prepare dishes from raw ingredients each day, supporting local producers and maintaining higher nutritional standards. In the US, restaurants often depend on pre-processed components to speed up service and reduce costs. This affects both the nutritional content of meals and the social experience of dining out, as Europeans tend to spend more time at the table. Government policy plays a central role in shaping these systems. The EU's agricultural policy supports small farms and traditional products, while the US Farm Bill favors large-scale commodity crops used mainly in processed foods. These choices influence what ends up on store shelves and what becomes the default diet for most people. Local food systems remain stronger in Europe. Shorter supply chains mean that food travels less distance from farm to market, preserving freshness and reducing the need for preservatives. In the US, the average grocery item covers far greater distances, which increases reliance on additives to maintain shelf life. Labeling requirements in Europe are stricter and more transparent. Consumers have access to clear information about origin and content, while American labels often use vague or marketing-driven terms. This transparency allows European shoppers to make more informed decisions about what they buy and eat. Antibiotic use in agriculture is another area of divergence. European livestock receive far fewer antibiotics than their American counterparts, reducing the risk of antibiotic resistance in the population. This outcome is less a matter of consumer choice and more the result of deliberate policy. Cultural habits reinforce these structural differences. Europeans are more likely to eat together, to treat meals as an occasion, and to avoid eating on the go. Americans, by contrast, are more likely to eat alone or while multitasking, and a significant share of meals are consumed outside the home or even in cars. These patterns have long-term economic consequences. Americans spend more on treating chronic diseases linked to diet, while Europeans enjoy some healthcare savings thanks to better baseline nutrition. The upfront cost of higher quality food in Europe is partly offset by lower long-term medical expenses and improved well-being. The interplay between regulation, market structure, and culture means that food quality is not simply a personal choice, but a collective outcome. This dynamic, in turn, shapes broader experiences of health and satisfaction, factors that interact closely with other aspects of daily life. Among these, the distribution of wealth within society plays a crucial role in shaping both individual and collective well-being. The wealth inequality effect. A core factor shaping differences in life satisfaction between Europe and the United States is the degree of wealth inequality within each society. The Gini coefficient, a standard measure of income distribution, is consistently lower in Europe, averaging around 30, than in the US, where it sits near 41. This indicates that European countries distribute economic resources more evenly, and this has wide-ranging consequences for how people experience daily life. Relative wealth, not just absolute income, plays a crucial role in shaping well-being. People tend to compare themselves to those around them. In more equal societies, such as those in Europe, the gap between low and high earners is less visible. Mixed-income neighborhoods are common, with professionals, service workers, and retirees often living in close proximity. This reduces the stress and resentment that can arise from stark income differences. In the US, residential segregation by income is much more pronounced, with clear divides in housing quality, school funding, and neighborhood amenities. The result is a daily reminder of economic status and a heightened sense of inequality. The effects of inequality start early. European children from low-income families have a better chance of moving up the economic ladder than their American peers. Social mobility is higher, and the sense that one's circumstances can improve reduces the psychological burden of poverty. By contrast, in the US, a child's future earnings are more closely tied to parental income. This awareness of limited upward mobility can create persistent anxiety and erode optimism about the future. Workplace dynamics also reflect these broader trends. In Europe, the pay gap between executives and average workers is narrower. CEOs typically earn about 50 times the average salary, compared to ratios of 300 to 1 in the US. Such disparities are not just numbers, they affect morale, motivation, and the sense of fairness among employees. European workers consistently report higher job satisfaction, even when average wages are lower, in part because compensation feels more proportionate and transparent. Public services help to level the playing field. European cities provide well-maintained parks, reliable public transportation, and quality schools that are accessible regardless of neighborhood income. In the US, the quality of these services often depends on local tax bases, leading to vast differences in public amenities. This means that in Europe, access to basic services and infrastructure is less dependent on personal wealth. Housing policy further shapes the experience of inequality. Rent controls and public housing programs in Europe moderate living costs and maintain economically diverse communities. In the US, the housing market is more market-driven, and high costs often push low-income families into less desirable areas. As a result, Europeans are more likely to share public spaces and services with people from a range of backgrounds, fostering social cohesion. Taxation and redistribution policies play a major role over time. European countries tend to use progressive tax systems and invest heavily in social programs that redistribute wealth and reduce long-term inequality. The U.S. tax system, especially since the 1980s, has become less progressive, with lower rates on capital gains and inheritances. This has allowed wealth to concentrate at the top, amplifying disparities. Social safety nets provide an additional buffer. Universal healthcare, generous unemployment benefits, and pension systems in Europe help prevent sudden drops into poverty. This security lessens the psychological impact of income differences, as people know basic needs will be met even in hard times. Education systems either reinforce or reduce inequality. European universities, with low or no tuition, allow students from all backgrounds to pursue higher education without incurring heavy debt. In the U.S., high tuition costs and student loans perpetuate intergenerational wealth gaps, making upward mobility more difficult for those from less affluent families. Consumer experiences also differ. In Europe, people with average incomes can access many of the same goods and services as wealthier citizens, from healthcare to cultural events. In the U.S., markets are more stratified, with large differences in quality and access depending on income. This daily exposure to inequality can affect self-esteem and life satisfaction. Political institutions and policies reinforce these patterns. European governments tend to implement measures that limit wealth concentration, such as higher inheritance taxes and stronger labor protections. In the U.S., weaker labor unions and less redistributive policy have allowed greater accumulation of wealth at the top. Crime rates and health outcomes reveal further impacts of inequality. European cities typically have lower rates of property crime and violent offenses than American cities with similar average incomes. Life expectancy in Europe varies less by income level, while in the U.S., health disparities are wider and more closely linked to economic status. Social trust is another area where inequality leaves its mark. Europeans report higher levels of trust in both strangers and institutions, a pattern often attributed to more equal societies. In the U.S., visible gaps in wealth can undermine trust and create a sense that different rules apply to different groups. Long-term, these patterns influence generational prospects. European policies, such as public pensions and inheritance taxes, help prevent extreme wealth accumulation across generations. In the U.S., wealth is increasingly concentrated among older generations, making it harder for younger people to build assets and achieve financial security. Union representation also matters. With about a quarter to a third of European workers in unions, collective bargaining keeps wage disparities in check. In the U.S., union membership has declined sharply, reducing workers' leverage and allowing gaps to widen. The consequences of these differences are evident in everyday life. Europeans across the income spectrum can generally afford decent housing, healthcare, and leisure, while many Americans struggle to cover these basics. The psychological strain of insecurity and visible inequality in the U.S. weighs on overall life satisfaction. These underlying differences in wealth distribution set the stage for how economic comparisons are perceived. The way income is measured and presented, especially when converted between currencies, can further distort the picture of prosperity on each side of the Atlantic. The dollar's distortion. The way international statistics present economic comparisons often gives a distorted view of European prosperity. A central reason for this is the influence of the US dollar. When European incomes are converted into dollars for global rankings, the results can be misleading. The dollar's exchange rate fluctuates daily, driven by financial markets and investor sentiment, rather than the actual cost of living in Europe. As a result, the apparent gap between American and European incomes can widen or shrink dramatically with currency movements, even when nothing changes for families on the ground. At present, the US dollar stands near historic highs against the euro, making European GDP per capita appear much lower in dollar terms. For a German worker earning 50,000 euros, the value of that salary in dollars might drop by several $1,000s in a year, even though their actual purchasing power in Germany remains steady. This kind of volatility creates the impression that Europeans are falling behind, when in reality, their standard of living is largely unaffected by the currency shift. Exchange rates can also swing in the other direction. If the euro strengthens against the dollar, European GDP figures in dollar terms suddenly rise, without any real change in daily life. Economists project that as interest rates between the US and Europe converge, the euro may regain ground, reversing the current narrative. A 15% appreciation in the euro would increase European GDP per capita by thousands of dollars overnight in global rankings. But this would be purely a statistical adjustment, not a real improvement in living standards. The dollar's role as the world's reserve currency amplifies these distortions. Many commodities, such as oil, are priced in dollars, which means that currency shifts affect international trade balances more than domestic economies. For instance, a weaker euro makes imported energy more expensive for Europeans, but it also boosts European exports by making them more affordable abroad. These effects tend to balance out over time and do not necessarily lead to a decline in overall prosperity. To address these issues, economists use purchasing power parity, PPP, as a corrective measure. PPP compares what people can actually buy with their incomes in their own countries, rather than translating everything into dollars at current exchange rates. When measured by PPP, European living standards are about 90% of American levels, a far smaller gap than the 72% figure produced by nominal exchange rates. This adjustment shows that the headline numbers often exaggerate differences that are less meaningful in everyday life. Within Europe, exchange rate effects are uneven. Countries with strong currencies like Switzerland and Norway appear wealthier in dollar terms, while those with weaker currencies seem poorer. However, local price levels adjust accordingly. A coffee in Zurich costs far more than one in Lisbon. So currency conversion alone does not provide a full picture of purchasing power. History highlights how fleeting these effects can be. In 2008, a strong euro made European incomes look higher than those in the US, but today's near-parity exchange rate tells the opposite story. Throughout these swings, measures of life satisfaction and quality of life in Europe have remained stable, underscoring that exchange rates mainly affect international comparisons, not people's lived experience. The service sector is particularly affected by the dollar's distortion. Services such as haircuts, meals, and healthcare are consumed locally and priced according to local economic conditions. When these are converted into dollars, their value is often understated, as they do not participate in international trade and are insulated from global currency shifts. Investment flows also influence exchange rates. When global investors seek the safety of dollar assets, the currency strengthens, independent of real economic performance. Recent U.S. interest rate hikes have attracted capital and pushed the dollar higher, making European incomes look smaller in dollar terms, even if European economies continue to perform well. Labor and manufacturing statistics are similarly skewed. European wages appear lower to foreign investors when converted to dollars, but within Europe, these wages support a standard of living that is not reflected in the currency conversion. German exports, for example, become more competitive when the euro weakens, yet the domestic value of those earnings remains relatively stable. Tourism provides a practical example. Americans find European destinations more affordable when the dollar is strong, while Europeans are less likely to travel to the US. These patterns shift with exchange rates, but the underlying quality of life in each region remains largely unchanged. Media coverage often amplifies the psychological impact of exchange rate movements, fueling narratives about decline or resurgence that do not match the lived reality. Most Europeans do not think in dollars, and their daily decisions are shaped by local prices, not international currency charts. Recognizing the limitations of exchange rate-based comparisons is essential for understanding how prosperity is experienced. While financial statistics can shift rapidly, the deeper question is whether these numbers capture what actually matters to people. This brings us to the challenge of measuring happiness and well-being, which requires a different approach than simply tallying incomes or currency values. The happiness measurement. Assessing happiness across societies requires a different set of tools than those used for measuring income or productivity. In Europe, surveys designed to capture life satisfaction look beyond economic output, incorporating factors such as work-life balance, social ties, and access to shared public resources. These surveys consistently show that Europeans rate their overall well-being higher, even with lower average incomes in dollar terms. The results highlight aspects of daily experience that are not reflected in GDP figures, but hold significant weight in how people judge their own quality of life. The methodology behind these happiness surveys reveals important cultural contrasts. European respondents tend to value time spent with family, leisure, and strong social networks over material accumulation. In American surveys, priorities often shift toward career advancement and personal wealth. These differences in what people consider essential for a good life help explain why traditional economic comparisons can miss the core of what makes people feel satisfied or secure. Work-life balance is a central theme in European happiness research. Surveys ask not only about income, but also about how people use their time and whether they feel in control of their schedules. Europeans report higher satisfaction with the amount of paid leave and flexibility they have, which allows for more time with loved ones and personal pursuits. In contrast, American workers, despite higher average earnings, often express frustration about limited vacation and the pressure to prioritize work over other aspects of life. Community and social connections are also key elements. Regular contact with neighbors, participation in local events, and a sense of belonging all contribute to higher reported life satisfaction in Europe. Urban design supports these outcomes. Walkable neighborhoods and accessible public spaces make it easier to maintain social ties. In the United States, suburban sprawl and car dependency can make social interactions less frequent and more dependent on individual effort, even in wealthier communities. The importance of public services emerges clearly in these measurements. Access to healthcare, reliable public transportation, and stable housing are all factored into European surveys. Respondents express a sense of security, knowing that illness, unemployment, or rising rents are less likely to disrupt their lives. In the US, the absence or unpredictability of these supports can lead to persistent financial anxiety, even for those with steady jobs. Education and opportunity are included as well. Europeans report satisfaction from having affordable, high-quality schools and universities, both for their children and for themselves as adults. The ability to pursue education without incurring overwhelming debt contributes to a sense of long-term stability. In American surveys, concerns about student loans and the cost of higher education often surface as sources of stress and reduced well-being. Environmental quality is another dimension considered in European happiness indices. Clean air, accessible green spaces, and safe food are routinely mentioned as contributors to life satisfaction. These factors are not always captured by economic metrics, but they shape daily routines and overall health in ways that are deeply felt. Americans may place a greater emphasis on disposable income, but Europeans often prefer to trade some income for a cleaner, more sustainable environment. Political participation and trust in institutions also influence happiness scores. Europeans report higher satisfaction when they feel their voices are heard and their rights are protected through democratic processes. The ability to participate in local governance, vote in elections, and join community organizations adds to a sense of agency and belonging. In the US, frustration with political polarization and economic inequality can dampen overall satisfaction, even in periods of economic growth. Transportation and urban convenience are measured as well. Europeans frequently cite the ease of getting around by foot, bike, or public transit as a contributor to happiness. Shorter commutes and less reliance on cars leave more time for leisure and reduce daily stress. Americans, while enjoying higher car ownership rates, often report dissatisfaction with long commutes and traffic congestion. Cultural activities and food traditions also play a role. Regular access to museums, concerts, and local markets is seen as part of everyday life in many European cities. Shared meals and connections to food sources are valued for their social and health benefits. In the US, these experiences are sometimes viewed as luxuries rather than routine, shaped by higher costs and less accessible infrastructure. The time horizon of happiness measurement differs as well. European surveys often focus on sustained well-being over years, while American polls may emphasize current financial conditions. This distinction helps explain why Europeans report steadier happiness levels during economic downturns, while American satisfaction tends to fluctuate more with the business cycle. Taken together, These surveys reveal that prosperity is not defined solely by income or consumption. Instead, it is shaped by the stability, opportunities, and social structures that support daily life. As societies evolve and new challenges emerge, the way happiness is the future of prosperity. Looking ahead, the definition of prosperity will likely shift as technological and demographic forces reshape economies. Automation is already altering the nature of work, and as machines take on more routine tasks, the value people place on leisure time is expected to rise. In a world where marginal income gains from additional work diminish, the ability to enjoy time away from work could become a more important marker of well-being than salary alone. Europe's economic model, which has long prioritized work-life balance and guaranteed paid leave, appears well-suited for this transition. Policies that distribute leisure more broadly, rather than concentrating gains among a few, may become increasingly relevant as the traditional link between labor and income weakens. Demographic changes reinforce this trend. Europe's population is aging, and this shift is changing priorities in ways that go beyond economic output. Older societies tend to value healthcare, retirement security, and social connection more than maximizing productivity. European systems, with their universal healthcare, established pension programs, and urban environments designed for accessibility, are already structured to address these needs. These features may help Europe maintain social cohesion and stability as the population grows older, even if economic growth slows. The advancement of automation will present challenges for labor markets everywhere, but the presence of robust safety nets can ease these transitions. European countries offer more comprehensive unemployment benefits and retraining opportunities, giving displaced workers time and support to adapt. In the US, where benefits are less generous and often harder to access, workers facing automation-related job loss may experience greater economic disruption. The European approach, while sometimes criticized for slower productivity growth, can provide more stability during periods of rapid change. Remote work is another area where existing European strengths may become more valuable. As more jobs can be done from anywhere, the appeal of walkable cities with strong public services and cultural amenities grows. European urban planning, which emphasizes density and mixed-use neighborhoods, supports a lifestyle that is less dependent on long commutes and private vehicles. In contrast, many American suburbs, built around car travel, may struggle to adapt to changing preferences among workers who can choose where to live. Pension and healthcare systems will face increased pressure as societies age, but the structure of these systems matters. European pension programs are generally based on more realistic retirement ages and contribution rates, allowing for gradual transitions out of the workforce. In the US, Social Security relies on assumptions that may prove unsustainable as the ratio of workers to retirees falls. Similarly, Europe's universal healthcare systems can scale more efficiently to meet the needs of older populations, while the US system's higher costs may limit flexibility. Urban design will play a larger role in supporting quality of life for seniors. European cities, with their public transit networks and accessible services, allow older residents to remain independent longer. In the US, car-dependent communities may lead to greater isolation among the elderly, especially for those unable to drive. These differences in infrastructure have direct consequences for well-being as populations age. Education will also need to evolve. As automation changes the skills required for employment, systems that emphasize broad learning and adaptability may prove more resilient. European countries, with their focus on general education and lower tuition costs, reduce the financial risk of pursuing new skills. In contrast, high education costs in the US can pressure students to choose fields based on short-term job prospects, rather than long-term adaptability. Social cohesion and attitudes toward change will shape how societies navigate the disruptions ahead. European countries, with stronger safety nets and less inequality, may be more open to adopting new technologies. In the US, anxiety about job loss can slow acceptance of innovation, as workers feel less protected against economic shocks. Environmental and sustainability concerns will further influence the trajectory of prosperity. Europe's investments in public transit, renewable energy, and urban green spaces align with both demographic trends and climate challenges. These choices may help European societies maintain livable cities and stable communities, even as external conditions change. As these shifts unfold, The ways societies measure and pursue prosperity will need to adapt. Traditional indicators like GDP may become less central, while factors such as leisure, health, and social connection gain prominence. Some European countries already track these dimensions systematically, offering a framework that could inform future policy. The ability to adapt policy to new realities will be crucial. While no single model offers all the answers, the next stage of prosperity will likely depend on how effectively societies balance economic security, quality of life, and the demands of a changing world. With these possibilities in mind, it is worth examining which policy approaches have shown promise and could be adapted elsewhere to support broader well-being. Policy lessons. Policy lessons from both sides of the Atlantic show that certain European approaches can be adapted to American contexts without undermining economic performance. Paid family leave is a clear example. In states like California and New Jersey, paid leave programs provide new parents with 6 to 12 weeks of partial pay, funded through small payroll contributions. Employers in these states report high retention rates and reduced recruitment costs, offsetting the modest expenses of the programs. With similar policies now covering over a quarter of the U.S. workforce through state-level initiatives, evidence suggests these benefits are compatible with American labor markets. Childcare support, long a hallmark of European policy, has also been tested in parts of the U.S. Washington, D.C. Universal Preschool Program, in place since 2008, offers free care for 3- and 4-year-olds. The result has been a 10 percentage point increase in maternal workforce participation, with no significant loss of private childcare providers. Colorado's childcare tax credits have lowered family expenses by $1,200 per year and created thousands of new childcare jobs. These results indicate that targeted childcare policies, modeled on European systems, can scale nationally and improve both family finances and labor force participation. Technology and innovation policy offer further lessons. The Draghi report emphasizes the importance of removing barriers to cross-border investment and building pan-European funding mechanisms for high-tech sectors. In the U.S., regional initiatives like the Midwest Governors Association's research funding for advanced manufacturing show how cooperation across state lines can drive innovation without requiring central coordination. Both approaches highlight the value of strategic investments and removing administrative obstacles to growth. Worker protections inspired by European models are gaining traction in several U.S. states. Massachusetts' paid sick leave law reduced workplace epidemics by 40% with neutral effects on business growth. Oregon's predictable scheduling requirements lowered employee turnover in retail by 15%, saving businesses on recruitment and training. These examples challenge the idea that stronger labor standards necessarily harm competitiveness. Healthcare reform at the state level shows that elements of European systems can function within the American framework. Maryland's hospital price controls have slowed medical cost growth, while Rhode Island's focus on primary care has cut specialist visits and improved preventive health. Though not as comprehensive as European systems, these targeted reforms demonstrate that significant cost savings and better outcomes are possible without a complete overhaul. Education policy innovations also reflect European influence. Tennessee's free community college program increased graduation rates without raising overall state spending. New York's tuition freeze and income-based repayment options have eased student debt burdens. These results suggest that selective adoption of European-style education finance can improve access and outcomes without requiring full public funding. Workforce development programs modeled after European apprenticeships are being implemented in states like South Carolina and Colorado. Paid apprenticeships and career advancement accounts have boosted retention and provided workers with flexible pathways to new skills. These efforts show that elements of Europe's workforce system can succeed in the more decentralized U.S. labor market. Local housing and transportation policies further illustrate the potential for adaptation. Minneapolis eliminated single-family zoning, leading to increased affordable housing options. Portland's inclusionary zoning has created below-market units while maintaining construction rates. Boston's bus priority lanes and Seattle's transit-oriented development have reduced car dependence and improved mobility. These steps, while not as sweeping as European models, demonstrate that incremental changes can yield practical benefits. Energy policy and digital governance also provide examples of successful adaptation. California's renewable energy targets and Texas's wind power expansion have matched or exceeded European benchmarks. Vermont's data privacy law and Illinois' biometric protections show that American states can implement EU-style digital regulations without stifling innovation. The experience of progressive states suggests that policy adaptation, rather than wholesale imitation, is most effective. Programs that deliver universal benefits and spread costs broadly tend to gain the most traction. The strongest results come from tailoring European lessons to fit local institutions and values, rather than trying to replicate entire systems. Economic and health outcomes in these states challenge the notion that European-style policies inevitably reduce competitiveness. States that have adopted elements of paid leave, expanded healthcare, and invested in education have often outpaced their neighbors in growth, health, and life satisfaction. These results indicate that quality of life improvements and economic performance are not mutually exclusive. As these policy experiments accumulate, the gap in well-being between the most innovative American states and leading European countries has narrowed. The evidence suggests that strategic, targeted reforms, drawing on the best of both models, can improve daily life without sacrificing economic flexibility. This raises important questions about what truly drives prosperity and how societies choose to measure and pursue it. When comparing Europe and the United States, it becomes clear that economic strength is not just about income levels or GDP rankings. European societies place a strong emphasis on quality of life factors. Universal healthcare, paid leave, accessible public services, and robust social safety nets. These elements, though absent from traditional economic statistics, shape daily experience and contribute to higher reported happiness. As global thinking shifts toward broader measures like purchasing power parity and quality of life indices, Europe's approach appears increasingly relevant. The evidence suggests that prosperity is not defined by financial metrics alone, but by the systems and policies that enable people to lead